Hi, good evening, everybody. I want to welcome you to this webinar about Bluetongue. Been brought to you by Munster Bovine, and I'm delighted we have some very good speakers tonight. Our own Doreen Corridan, the CEO of NCBC, and we've Conor McAloon from UCD. I'll introduce them a little bit better in a moment. I think the surprising thing about tonight is we have over 500 registrations for this webinar. Hopefully, everybody will get on, or as many people can get on as possible, and it reflects a little bit of the seriousness and the level of interest that has gone on around Bluetongue in the last month or two. And I think from Munster's point of view and our own point of view, the bull studs and so on, we've been engrossed in it since January on account of the risk. And in fairness, there's a lot of knowledge has been built up around Bluetongue and managing and prevention and so on. So look, we think it's timely maybe to throw in our tuppence worth into the whole discussion, particularly around the breeding and fertility side. So it's important for us. There is a chat function that you should have. And we want you to put in questions. We've got some questions already from farmers, a lot of them practical questions around vaccine and prevention. So hopefully we'll get through as many of those questions as possible. Um, First up tonight is Professor Conor McAloon. And Conor is a lecturer in UCD in Herd Health. He's also a professor of epidemiology, and he's the director of Severa, which is the Centre for Veterinary Epidemiology and Risk Analysis. So Conor knows the maths, right? He has all this worked out, how things happen and how they turn up in the country. And often we don't even, when we're talking about words like epidemiology, what does that mean to us? So it's really looking at how disease works, it spreads through a population, and how it's managed. Hopefully, that's a reasonable definition, Conor. So he's going to talk a little bit about our current state, what's going on, our infectious risk, etc. So, and after Conor, then we'll have Doreen. I'll introduce her at that point. So, Conor, I think take it away, and we'll see how we get on.
Thanks, Martin. You might just let me know if this kind of displays properly. Sorry, I'll just get that. Um,
Yeah, I think we're coming on. Okay, Conor, I think you're good. Yeah.
okay, thanks, Martin. Yeah, well, listen, thanks very much for the introduction, for the invitation to speak. So, just a bit of an update from my side. To get this working. Yeah, so I guess a update on the current Irish situation. So I suppose people will be, hearing about this in the media, and will a lot of this won't be new to people, but I guess we would have heard of these sort of initial cases in Wexford. And then more recently, I suppose in kind of more recent weeks, there were cases kind of coming a little bit more dispersed than that. So into the kind of Laois Kildare area, then kind of isolations in Louth, kind of Meath direction, and then further north from that initial site into Wexford and Wicklow. And the fact that this is now not just one site, but in fact across multiple sites is important, and it's significant, and for reasons we'll get to kind of perhaps later on during the presentation. And so the first question, just to clear up a few things, because I guess I would have heard a few kind of theories about why it may have arrived in the country, and I suppose the kind of the most likely reason is that, as we know, this is spread by midges, and the transport of midges, these what we call plumes of midges, are essentially clouds of midges with these kind of particular weather events, can be blown across water bodies. So this is pretty well established for midges. Happens from the UK into Ireland. Happened for Schmallenberg. It happens from mainland Europe into the UK, and Indonesia into Australia is another part of the world where this happens. So very well established transmission route between countries. Weather events effectively blowing these midges across this body of water. What's important from our point of view is that our prevailing wind is obviously in the opposite direction. But in this case, we had kind of perfect storm of, or perfect alignment of weather conditions, which brought this plume or cloud of midges across from infected areas of the UK. And we kind of think the most likely date for that, and this is kind of the model that shows this, is around the sort of 24th, 25th of September 2025. So that's kind of an indication of what was going on. But I guess the key picture to take from this as well is that it's not just isolated to individual parts of the country. This kind of seems to have dispersed around the place. So kind of support that idea of infection in different areas of the country. I guess one of the things that farmers will be trying to figure out quite quickly is the likely impacts of the disease. So first of all, just kind of flagging some of the clinical signs. And the point I always make here is that clinical signs are quite useful to help identify the disease on the farm, but they can actually be a distraction when you're trying to assess the impact. And that's because the biggest impacts are often occur well after the infection has been in the herd and perhaps even gone from the herd. It's often only then that we would see these sort of impacts. So in terms of clinical signs, things like burnt muzzles, these are kind of the more obvious ones, sort of ulcerations and erosions within the mouth, and also kind of drooling saliva and kind of nasal discharge, these sorts of issues. So I suppose the reason I talk about these as being perhaps a distraction is that I can imagine many farmers looking at that and said it looks like a bad case of photosensitization and perhaps not being that concerned about it. But really the big concern for farmers will be not those clinically obvious clinical signs, but really it's the kind of the silent impacts in terms of fertility, milk yield, calves with defects. And the key point here is that these are usually detected well after the event has occurred and well after you've had any chance to actually interrupt that infection on the farm. Just to draw out one of those particular clinical signs and a fairly, what seems to be a characteristic feature of this disease, are these calves born with effectively these brain defects. And just to kind of highlight this example from a case in Germany. So this is a calf born, apparently normal, a bit kind of odd behavior, lying down on the straw, kind of tilting its head backwards. But in between these bouts would often kind of move around, could drink from the mother, if kind of helped and assisted. But I guess the key point here, or the interesting thing, is whenever this calf was opened up for postmortem, it was euthanized at 6 weeks of age. And this is the brain from this calf. So the top right panel there is a normal brain, what it should look like on whenever it's cut through. And you can see from this one, effectively, this infection has effectively wiped out all of the normal brain tissue in this calf. So where we should have this normal brain tissue, there was effectively a sac of fluid that point. So massive impact in that individual calf. So I guess the issue here is when you have multiple of these animals born on the farm, it can become quite a problem, as you would expect. So in terms of making decisions for 2026, I guess this is the key burning question for farmers now as they get over the kind of stress of calving, trying to move into breeding. Many farmers now want to make decisions about that breeding season. I suppose the key point here is it's really, really hard to predict what will happen. And so one of the ways we try to think about this is how likely, first of all, is a farm to get challenged or to get infected with this disease or this infection? And then secondly, what will happen if your farm gets infected? The third bit here is what can you do to prevent it? And that one is quite simple and straightforward. And I guess it'll come down, further down the line, but there are kind of pretty limited range of options that we have available to us to stop the disease, and vaccination obviously is a key part of that. So taking those in turn, the first question, as we said, is, are farmers likely to get infected in 2026? And there are two ways in which this could occur. So one of the things that's quite hard to kind of get your head around with these detections that have occurred recently is that we think the vast majority of those occurred with animals getting infected at the tail end of 2025. So getting infected in the autumn and into the winter of 2025. And they're only really being detected now, some of those through routine surveillance, at least one of them through a post-abortion blood sample. So some impact kind of being displayed there. The point here is that in most cases, that infection shouldn't be able to overwinter. It should sort of burn out over the winter, and that's because it basically requires a temperature of about 12 degrees for this virus to sort of replicate within the midges. So that shouldn't really happen, and the infection doesn't transfer from the midge to the offspring over the winter, and most adult midges die off over the winter. So the key point here is that it shouldn't happen, but we know that it does in kind of rare enough occasions. And the reason why it's important we're now getting more and more farms infected, or reason why that is significant, is that as we pick up more and more infection in the farm from late of 2025, the chances of this successfully overwintering dramatically increase. The second point is that even if we don't have a successful overwintering this year, it's now well established on our flight path in the UK. So that part of Devon and Cornwall where we have these kind of weather events, that's right on our flight path, as we say. And when we get the same sort of weather conditions occurring, we're likely to see those midges transport across the Irish Sea again and starting up new infections. So that's the key point here. Although Wales is somewhat similar to us, we think this part of, as we say, Devon and Cornwall is probably where we got Schmallenberg from in 2012. And that seems to be really significant for us in terms of these weather events that are a problem for us. Once it gets established within the country, then it can spread very, very quickly. So I always kind of use this graph as this map as an example. So this is from Germany and shows the number of cases that were identified from between May of 2023 into the following year of the end of April 2024. And in the following year, it just spread really, really quickly through the whole country. So that's kind of an indication of what can happen once it's established in a country and we get a full season of transmission in the country. Germany's a big country, but it's spread or ripped through the country very, very quickly within that year. So that can occur within a single vector season. So that kind of covers off how likely perhaps farms are to get infected. The next part is like, what's the potential impacts of the infection if a farm or a herd does get infected? And here it becomes a little bit confusing. So the point here is that there are two fairly different production impact pictures emerging. One of those is from mainland Europe, and that's from the early days of the infection being established there. And these are from reports in France, Belgium, and the Netherlands, where the impacts were really, really significant. And then more recently, our kind of more local neighbor in the UK. And so just taking those in turn, if we look at Europe, I think most people would agree these were catastrophic impacts in sheep and cattle. So whenever I heard of this infection kind of being identified in January, at the tail end of January, I contacted one of my colleagues over in Belgium, and this was his response: the industry in Ireland should expect the worst, because he had seen, had seen really, really catastrophic impacts in his clients and in his farmers in the country, and those impacts were due to mortality. So lots of animals dying, and really, really significant fertility impact. So early embryonic death, abortions, these congenital defects that we talked about in calves born effectively without brains, and then these kind of significant milk yield losses in some of these farms as well. The other aspect of that is that more recently we've been hearing kind of reports from the UK where the impacts have not been as significant, and so here we're hearing of smaller numbers of animals clinically affected. So the infection has been kind of there since 2023, but still, reports are that less animals seem to be getting, clinically affected, shown with clinical signs. Smaller numbers of animals, as we said, within herds or flocks. Much lower animals, with mortality impact, much lower animals dying. But the key point here is that even though there's this kind of, it's well established now that those impacts in the UK have been less, within individual herds in the UK, there have been reports of really, really substantial fertility impacts in particular. So these stem from infertility in bulls. So there are kind of reports of 50-60% of herds being empty at the end of the breeding season, and that being attributed to largely to bulls. And then in some cases, a large proportion of the herd empty associated with early embryonic death in female breeding stock on the farm. And then kind of abortions if infection is a little bit later in gestation, and stillbirths as well. And these kind of calves with congenital defects, as we talked about. So just kind of last couple of slides now, I suppose what does this all mean for Irish farmers? And I guess the question most people will be trying to answer is, should they vaccinate? I suppose trying to weigh that up in terms of costs and benefits. I think if we were expecting similar impacts to mainland Europe, it would be a very, very easy decision, because those effects were so dramatic and so catastrophic. The apparently less significant impacts in the UK sort of complicate that a little bit, but I guess I would say that even in the UK, fertility impacts within individual herds have been really, really significant. And this is where our particular breeding style or system in Ireland becomes important, because seasonality, could leave us particularly vulnerable. The reason for that is that if we take our calendar year and think about when breeding happens, kind of end of April, start of May, perhaps, if that as that X kind of shows, most of our stock then will be in early gestation throughout sort of May and June, and then second trimester will be towards July, August, and September, with late gestation, final trimester, October, November, and December. So that's kind of where we expect animals to be in our traditional seasonal system. The problem that we have is that if we map that on top of when we expect midges to be most active, it sort of aligns, it's sort of a perfect alignment of risk effectively. Most of the midges will start kicking off around May, June, July, August, into September, and kind of dying off towards October. And that is the time when most of our farms will be at biggest risk for fertility impacts, because if it affects farms, then we can get early embryonic death if the animal's in early gestation, and we can get these congenital defects in the calves if they are born or if they are infected whilst the cow is in mid-gestation, and then abortions towards late gestation. So just to summarize those kind of few points, there's a lot of uncertainty about what might occur in 2026. The chances of the virus overwintering increases with every kind of new case detected. But the point here is that the virus is now well established in Devon and Cornwall, that part of the UK that seems to bring us these kind of new midge plumes in several times over the course of the summer. And the way I would frame this for people is that the spectrum of potential production impacts for Irish farmers ranges from mild, it could be mild, perhaps not cause any issues, but it could also be catastrophic for individual farms in terms of large numbers of animals losing pregnancies in the middle of the summer, and making this point again that seasonally calving herds are particularly vulnerable. So that's all from me, Martin.
Good to you back in action. Thanks, Conor, very much. A nice brief and run through, and I suppose it's assessing the risk there. And my understanding and just kind of summary, that alignment of weather conditions created the advantageous plume of midges to cross over. And there's still, as you say, as we're tracking up the number of cases that are being identified or positives being identified in Ireland, the risk of overwintering is more. Am I correct saying that? Is that the right conclusion?
Yeah, I guess the point with it is that, as you start to, it's like, the kind of the classic iceberg analogy. As you start to pick out new cases, you can be sure that there's a vast bulk of infections underneath the surface that you haven't been able to detect and probably won't detect. And the point, I suppose, is that, once an individual farm gets infected, it's most likely that it burns out over the winter and doesn't overwinter. But if you have, instead of 2 or 3 farms infected, if you now have, hundreds of farms infected, the chances of that successfully overwintering increase, which means you have a new source of infection early in the mid-season then.
Okay, and just a couple of interesting things coming out. We've a heap of questions in, a lot of them around vaccine. So I'm going to leave Doreen, she's going to deal quite a lot with vaccine and might answer 80-90% of those questions. But there's one or two here. Does the UK have the same strain BTV3, or is it affected by other strains like 8 or 12? I think someone picking up that information. Just maybe a bit of commentary on the fact there's different strains.
Yeah, so the key ones are those 3 actually. Yeah, so 3 is the one that's kind of spread very dramatically through Europe from late 2023. So that's the one that's kind of really dramatically spread through the UK, and it's the one that we have. That's the same one. Yeah, that's the main one in the UK, but they also have 8, and they have 8 down in that part of Cornwall that we say is of risk of us. So it's something to be aware of kind of down the line. There was also kind of more isolated detection of 12 in the UK, and so those would be the kind of the 3 ones there that have been isolated over there.
Okay, because look, we're having a chat about this before, and I think BTV3 is what we're dealing with, is what our vaccines are designed for. And I think, okay, well, I think the risk of yeah, there's always a risk of things happening, but the main thing we have to deal with is BTV3. I think you'd agree with that, Conor, yeah?
Yeah.
Okay. The other one there was, and again, it mightn't be within our remit here. We're not department people, but the question was asked, if I get a case now, am I restricted in terms of sale? Now, my understanding, and you can correct me, Conor, you've been on a few of these webinars. we're still in a notifiable disease bracket here. It's C, so it must be reported to the regional vet office through your vet or via lab and so on. So my understanding is up until that scheduling changes in July, we're still under that restriction.
Yeah, yeah. Well, it's still notifiable. Yeah.
Okay, so the key thing there for the person asking that question, touch your RVO. Your RVO will know if you test positive as such. One other point you made to me before I go to Doreen, Connor, is the importance of surveillance. How can farmers contribute to that surveillance for us, or in terms of any new disease coming in? What should they be doing in terms of surveillance? Yeah.
Yeah, well, I think it's kind of, you can see it from this case. So we think it came in, in September. We pick it up in January. So there's a lag there in terms of whenever these things are detected, and that's because of the surveillance system that's in place there, and it relies heavily on things like submission of samples into the local labs. So particularly abortions, and including the placenta with the cleanings with those abortions. So making sure all of those go to the lab, just kind of, yeah, it's just kind of enhances that surveillance, I suppose. BTV is not the only one. There are other kind of diseases coming across Europe as well. So just a general point, I suppose, that the more submission of samples that are suspicious, the better that our surveillance becomes.
Yeah, and I think it was a point you were making to me about possibly some parts of the UK, maybe we're not reporting enough, that there could be more going on. And that's going to relate a little bit to their lab system and so on. Is that correct?
I suppose hard. I mean, that's kind of anecdotal from speaking to some vets
Sure.
there, that sometimes they're kind of the view that maybe it's a different system that's operated over there in terms of private and public, private and kind of
Mm.
government labs, and there are kind of potentially some issues with that, but I guess it's slightly different here. But I just kind of emphasize the point, the earlier and the more frequent those samples are submitted, the better.
Okay, brilliant. No, no, excellent. Connor, that's fantastic. And you'll be back at the end.
Yeah.
There's lots of other questions there we can ask. No, I really appreciate that. And we'll flick over to Doreen. I'm going to introduce Doreen, CEO of the National Cattle Breeding Centre. And I think the important thing here, I think Doreen's emphasis on this is she's dealing with a herd of highly valuable stock of high genetic resource. And I think while we are also bound by regulations, which she'll talk about a little bit, it's very important that we're looking at the protection of that valued herd. So she's looked at this in a lot of detail and looked at how to protect ye as well as those bulls, because we do recognize that Bluetongue virus can be transmitted in germinal products, that is semen, from our perspective. And before she just joins, I just want to take one opportunity to congratulate Doreen from all of us on winning the STEM Woman of the Year in 2025. It's a huge accolade for someone from agriculture, and it's a huge accolade from someone from the breeding stable to win that. So just our congratulations, Doreen, and I have you in a public forum. So you can take away with your presentation now. Okay, thank you.
Martin, thanks very much. And it is great. And thank you very much for inviting me. Munster is always very close to my heart. So basically, what I'll cover here tonight is, I think the heading I put in was "Don't Gamble with Your Herd," and I think that is the key, because as Conor said there, the impact could be mild to catastrophic. So I'll talk about Bluetongue, but especially about fertility and about vaccination. And I think there are three takeaways, I think, tonight. Is the first thing is that Bluetongue poses a serious risk to fertility of the herd, production and mortality. And that includes the calf mortality, and that's both for beef and dairy herds. And the Irish system, we're really uniquely exposed. And the other thing is, we've spent the last 20 years getting to where we are now. And I think the important thing is that we protect it. And vaccination is the only proven method to actually protect our herds. And we have a window to protect our herds, and that window is now. And I think we need to take that, because the risk is too great. And with our Irish seasonal system, we're really, really exposed. The other thing I think it's important is there's no risk to human health. It's not a food safety issue. It's basically spread with the midges between animals. So if you have a positive animal, it's not contagious to other animals, but it can be infectious to midges who will spread it to the other animals. And our big concern is the health of our livestock, their production and the fertility for 2026. But also we have to look beyond 2026. As Conor says, is how likely is the Irish herd to get infected? Very likely. Is it going to be 26 or is it going to be 27? We do not know. But we clearly saw there from Conor how it came into Germany. But I think we have to protect now for 2026 and for 2027. Why are Irish herds so vulnerable? Especially dairy herds, but also beef herds. We have a compact calving season. And that means we have a compact breeding season. And our early and mid pregnancy occurs during the Irish peak midge season. So exposure to Bluetongue occurs in peak mid season when cows are at their most vulnerable. Because as Conor clearly showed there, is the mid season runs from May to October. And if we take that, that's when our cows are in early mid pregnancy, coming up to late pregnancy, but it's also when they're at peak production. If you take dairy cows, they're at peak lactation, and the vast majority of suckler cows that are out that stage actually rearing their calves. So Irish herds, due to the seasonality, we're far more vulnerable to a lot of the herds across Europe, where they have a really spread out calving pattern. Then if we look at the seasonal distribution, which Conor clearly showed, practically the same every year. It runs from May to October. It may peak in June, July with the midges, or it may peak in August, September. But the important thing is the midge season is from May to October. And it's the midges that actually spread the actual Bluetongue. Now, what is the impact? The impact clearly is fertility, production, and mortality. But this impact will be far beyond 2026 in the sense that if you suffer fertility this year and have a lot of early embryonic deaths, you'll have a delayed calving pattern. You'll have increased amount of empty cows for next year. You won't have as many replacements and you won't have them off your best cows. Milk suffers because if cows get hit in peak season, their milk production drops. And then mortality, especially among younger animals, and especially freshly calved cows. So I mean, it's quite high. And I think as farmers, it has taken us, if we all look at ourselves, it's nearly taken us 20 years to get where we want to, from the point of view of the good genetics in our herd, and also the good fertility. And the important thing is that we actually keep that and avoid the financial impact of losing that, because it'll take us a long time to actually get there again. The ADHB is a useful site to go on there in the UK. And basically, I mean, they've done out quite a lot of costings on it. And if you look at their costings, whether it's mild, moderate or severe, about a third of their costs are due to loss of production. Another third are mortality and fertility, so I mean, a little bit more than a third. So they're the costings. And in a 100 cow herd, it can easily hit, so I mean, over 65,000 in a dairy herd. And in a beef herd, so I mean, it's not far off it, especially when you look at the value now of beef animals. Right, so with fertility, what do we get if we get Bluetongue into our herd? And remember, the mid-season is from May to October, November. So the first thing we get is reduced conception rates. Then we get early embryo loss. We'll have a reduced 6-week calving rate in 2027 and beyond. We'll have abortions. We'll have premature births, stillbirths, and dummy calves. I mean, calves that won't suck, calves won't stud, and won't stand up. We get them going. Do we realise after spending a lot of time with them, We're going nowhere with them. Increased empty rates and empty cows. But the other big thing with fertility is once it's reduced in 2026, it can take years to bring back. As we all know how difficult it is and where we have got to now with our good 6-week calving rate, we've our bunch of replacements coming in, do you know what I mean, all ready to be bred at the same time, an even bunch. And once you lose that, it can take years to recover. So when we're looking at costings, we should not only look at the costings of 2026, but also 2027 and 2028. Then, if we look at the progress we've made, Bluetongue can undo that quite quickly and it can have a lasting impact. As if we look at Irish breeding and Irish fertility, we've had a massive collaborative approach. So I mean, between Irish farmers, dairy and beef, the dairy industry, the meat industry, so I mean, Tagish, ICBF, the National Genotyping Programme. We've an awful lot going on. And we're the envy of a lot of the farmers in Europe. And it's farmers that has built this. And this has resulted in our kilos of milk solids, so I mean, kilos of meat, our good fertility, our compact calving, and our genetic progress. And the important thing is that we need to protect this. And we cannot leave it up to chance, right? And when you see Conor there speaking about mild to catastrophic impacts, I don't think there was any other disease in my lifetime anyway, apart from foot and mouth, where we would actually speak with catastrophic impacts. So when fertility is affected, basically what we end up with is spread out calving pattern, increased replacement rate, lower kilos of milk solids, increased labour, later and fewer calves, so I mean, and various other issues. And fertility really is the engine, you know what I mean, that drives all of us. Now, what we have learned from European farmers is where vaccination rates were low in countries, fertility, production and mortality was severely impacted. And I think it's important that we learn from what happened across Europe. And where vaccination rates were high, herds were protected. And if 80% of herds vaccinate in Ireland, we'll really control Bluetongue and we'll actually prevent it spreading. And the key here is to protect our animals ahead of the risk period. And the risk period is the peak mid-season, which is May to October. And this is evidence, and we need to learn from our European farmers. Now, we have a window of opportunity, and I think this is the important thing. I know now we're after all a wet, dirty day, and the last thing you want to hear at night time is listen to pure misfortune. But the important thing is we have a window of opportunity, and it is today. And I think it's important that we do take this window of opportunity, right? And the time to act is now, because the mid-season starts in May, the breeding season starts in May. So the key is to go in and vaccinate now. So the first dose goes in March, the booster 3 weeks later, and have maximum immunity before the mid-season. But also have all your vaccinations completed before the start of the breeding season. And the key here is, and if we have a look here at this, is if we take now, as in today, if I go in with my first shot, the 12th of March 2026, my second shot is due in 3 weeks' time, which is the 2nd of April, and I'm protected from the 23rd of April onwards. So I'm in the best position. If I wait next week to vaccinate, which is fair enough, to bring kids home from school and so forth, and Patrick's week, on the 19th of March, my second shot is the 9th of April, and I have immunity then again 3 weeks later, the 30th of April. So I'm in a super position. So do it now or do it next week with the first shot, follow up 3 weeks later with the second shot, and I have my immunity built up before ever the breeding season starts. If I wait for a fortnight's time, still not too bad, 26th of March. Second shot gone in the 16th of April. I have my immunity from the 7th of May. But if I wait for 3 weeks' time, I will have my 2 shots gone in before the breeding season, the 2nd of April and 23rd of April, but I won't have immunity until the 14th of May. Because it's 2 shots 3 weeks apart, and it's 3 weeks after the second shot before I have immunity. And I really wouldn't like, especially for dairy herds, to leave themselves in that position that they hadn't protected, you know what I mean, until 14, 21st, 28th of May. Because you'll have gone in and done a lot of breeding at that stage. You'll need protection, right? And as Conor said, it all depends on when this incursion comes in, do you know what I mean, from the UK or from overwintering. We may get away with it, we may not. But I think the big thing is get in there now, but definitely get in the next fortnight with the first shot, second shot 3 weeks later, and then we have immunity.
Doreen, I'm going to ask you one or two questions. There's been a bunch of questions about timing, and I think people are getting kind of, I won't say confused, but there's the midge risk, which we want to get the vaccine in before. And then people are saying, well, breeding season. We've been asked, so a couple of questions for you. One, if I'm breeding a herd currently, I'm actually actively breeding now, what should I be doing?
Okay, I'll answer it after the next slide, Martin.
Okay, right. I'll
Yeah,
hold that
yeah,
one. Will I
yeah.
give you any other of those timing ones? Are you happy to work away for the moment?
I go to the next slide and then we'll take it, Martin.
Okay, very
Because
good. Off you
yeah,
go.
the big thing is the vaccine has been proven to be safe. It's an inactivated vaccine. It's the only scientific way to protect against Bluetongue. It has been used quietly across Europe, absolutely widely. There's only one vaccine available at the moment on the Irish market, which is Bultavo 3, which is from Boehringer, very good vaccine company. 50 million doses has been sold, and it has proven to be extremely safe. It's safe during pregnancy, it's safe for beef herds, it's safe for dairy herds, and it's also very safe from calves once they're over a month old. I certainly wouldn't vaccinate calves. I mean, they're at least 2 weeks. Now, this is the practical advice, is these are the numbers to remember. It's 2 doses that's required, 3 weeks apart, and the annual booster in 2027. So the practical tips is vaccinate the whole herd together, right? Some people will not have started breeding. Some people will be halfway through. Some people have just started. So I mean, just go in and vaccinate the whole herd. It comes in bottles of 50 doses. You can't get any smaller. You have to use them within 10 hours of opening, but it's an extremely easy vaccine to administer. So I mean, it's 1 ml intramuscular. So I mean, for dairy herds, so I mean, it's very simple. I know I shouldn't say it, but you can do it in the parlour, you know. Now, and the animals I do on the farm, I do all the cows, I do all the heifers, I do all the calves once they're over a month. But the real important animals to do are the stock bulls. Because across Europe, who has really, really suffered is the actual stock bull. They really have suffered. Because if a stock bull gets viremic, gets Bluetongue, he can be infertile for 2, 3, 4 months. He's literally out for the season. So the practical advice is 2 doses, 3 weeks apart, annual booster. Vaccinate the whole herd in the one go. It comes in bottles of 50, used within 10 hours of opening, very easy to administer. And I think for beef herds, the fact it comes in 50 dose bottles and smaller herds, 2 or 3 herds can come together a bit like the mehel of long ago. Do you know what I mean? That one of them does it in the morning, helps each other, and then the other one does it in the evening. And then both of them again are 3 weeks later going again to actually get it done. Vaccine, do you know what I mean, retailing at about €5 and absolutely super. Now, does that answer your question, Martin, on the vaccines?
It answers a hell of a lot of them. I'm just going to be really clear now on some of the questions. So, people are asking, some people are breeding at the moment, some people are calving in August, some people are calving in the autumn and breeding at different times. So, I think you've answered that. Everything before the mid-season, get them all done so you're protecting all stages, all animals during the mid-season. Is that correct, Doreen?
Absolutely, Martin. And the key is back to this slide, is try and get it done in the next fortnight. Because you have your first shot in, your second shot in by the 16th of April, and then you have your immunity by the 7th of May, which is just pre the mid-season. Now, it's better to do 3 weeks' time, 4 weeks' time, 5 weeks' time, 6 weeks' time than not to do it at all. But the idea is now and in the next fortnight.
Okay, so the key thing there is all is not lost. keep going because there's obviously going to be delays in getting supply and vaccine over the next while. If everyone's looking for it at the moment, there's lots of vaccine in countries, my understanding, and there's good vaccine available coming on that brand. So we all should be able to get it, but we will have this time, so it's important. It's important to get it in. So the other questions, just to note, I'll talk about sheep separately. I might take that at the end. There's a number of questions about sheep, but the big question here is, should I do calves? Why do calves? Some vets are recommending to do them, some not recommending to do them. What's your
Now,
thoughts on calves, Doreen?
with calves, I was speaking to Sinead Timothy there from Boringer, and she says that on the data sheet it said calves from a month old. But she said she certainly wouldn't go less than 2 weeks of age. The important thing you do calves is to stop them getting viremic and getting sick and getting mortality. I mean, I
Yeah,
think
so
that's the key thing. So the priority in the farm, Martin, is all the breeding females, 100%, and the stock bull, right? Then your next group of animals then are the young stock. I mean, the calves and the yearlings. And if you look at the value of stock at the moment, I mean, the value of calves, the value of weanlings, I mean, if I were a vaccine, it's just a must put them in there. And look, you're all busy at the moment, especially with the wet spring and cattle inside and so forth. You keep working all day, but what really takes up time is sick animals
okay,
and the
so
mortality.
okay, so really in that young stock, and again, if you're tiering, sometimes it depends how much money you have, but okay, the breeding stock, but those calves are susceptible to being ill. So really consider that as your future and look at the value of animals today. I think we need to be certain on that. Just one or two other quick things before I let you move on to the next part, because I'm conscious lots of people asking questions about vaccine. So another one is, will the if I give the vaccine to a stock bull, will the healthy stock bull hasn't got Bluetongue, will the vaccine interfere with his fertility, Doreen?
Absolutely not. Uh, what really interfere with it if you don't vaccinate him and he gets Bluetongue.
Well, I'd just be very worried seeing that we're vaccinating every bull in our stud and we're producing semen off them. So and the experience around Europe is not a bother in the studs of the vaccines. Isn't that correct?
Absolutely, all across European studs, they have all their bulls vaccinated. They saw no impact. Now, in very rare cases, what you may see after vaccinating animals is a slight rise in temperature. So I mean, and maybe lumps at the vaccination site. So the important thing to prevent lumps at the vaccination site, it's a 1 ml shot intramuscular. Try and avoid air bubbles, but also try and vaccinate on a dry day. I don't know it's difficult with the weather
Good
we've
on
been
you,
having.
Doreen.
It will dry up. It will dry up. So have
Yeah.
a dry day because if you have dry skin, so I mean you have a way less chance of actually rising lumps.
Okay, just as we're on vaccine on that theme of lumps, just and I'll pass a comment. Some people talking about interfering with TB tests and so on. Like any vaccine, try and avoid sticking it into the neck that you're on the side that you're testing on in case of lumps, particularly intramusculars. You'd agree with that, Doreen? Yeah.
Oh, absolutely, absolutely.
Yeah, and it's just the presence of the lumps and bumps. The vaccine in itself is not going to do anything to the TB test or the result of the TB test.
Yeah, there are
Uh,
50 million doses of this vaccine used.
Yeah, absolutely. Again, I'll address the sheep a little bit differently. I think you know what? There's a lot of those questions I think you've dealt with, Doreen. I'll keep an eye on them. Crack on because I know you've got a few other pieces to do around the bulls. Okay?
Yeah, the big thing here is to protect the Irish herd. Everyone has a role to play, especially the department from the point of view of surveillance, right? And we need to help the department with surveillance, farmers and vets. As farmers, we need to vaccinate. The more of us that vaccinate, the better, because if we could get over 80% vaccination, it'll really reduce the impact, so I mean, and protect the actual national herd. And then from Irish AI companies with our vaccination and testing protocols. And just in NCBC, all our bulls, we've been testing for BVD antibodies for the last 2 years, every 28 days, basically watching what was going on across Europe. Bulls are being currently vaccinated for Bluetongue. Our bulls then are being vaccinated, are being PCR tested for the virus every 28 days since January 26, and we're going to continue that. We've 30-day quarantine protocols in place for all the semen. And everything we do in AI is governed by the Department of Agriculture and EU regulations. So our current protocol will ensure that we can guarantee, do you know what I mean, that the semen is free from Bluetongue virus. As if you read any literature, how do you get Bluetongue? You get it from a midge. You get it from an infected needle. You get it from semen. You get it from embryos, right? So the big thing here is we've been testing for the last 2 years every 28 days. All our bulls have been vaccinated at the moment. And we're, as a grouping, we're talking to all the other AI studs in Ireland. We're on we developed out the protocol with the department. This is the best for Ireland. We're PCR testing every 28 days. We've our 30-day quadrant protocol and Department of Agriculture EU regulations. So, I mean, we will ensure that the semen you're getting from NCBC is free from Bluetongue virus. So, the bottom line here is it's your responsibility, I mean, to really protect your own herd, because we've too much to lose otherwise. It's the biggest risk, I mean, in my lifetime, to Irish herd fertility, right? And especially where we've gotten to from the point of view of genetics and fertility. Evidence from Europe is clear. Vaccination protects herds. We are lucky to actually have the vaccination. And Boring are quite confident, I mean, that they have enough vaccination for the country. I know some vets at the moment, they're waiting, I mean, until next week or the following week to have it. So talk to your vet. And I see vaccination as an insurance cost. Like if you have 100 cows, I mean, you have 40 young stock, I mean, 140 animals, 2 shots, €10, versus really potential losses are massive. I mean, as Conor says, they can be catastrophic, right? Because we do not know when the big incursion will come, whether it's 26 or 27. And we're on Cheltenham week at the moment, but the important thing is do not gamble with Bluetongue. I mean, because right across Europe, we can have learned so much from it. And the 3 takeaways I want to get tonight is the window is now to protect your herd. It poses a serious risk to fertility, production and mortality. Our Irish system, we're unique exposed because we've spent 20 years to get where we get to now. The mid-season is coinciding with females at their most vulnerable as they're in peak production and they're in early to mid-pregnancy, and vaccination is the only proven method to protect our herds. So that's it, Martin.
Very good, Doreen. We might get Conor back on screen if we can. If you stop sharing, Doreen, we'll get everybody on screen here. From brilliant. Look, I have a lot of questions. There's some I'm going to kind of some quick answers I'm going to give as I'm going along. Some I'll refer back to you, Doreen, and some into Conor's bag, right? So I just want to make sure that I capture as much as I can. The very last one that came in there, is it possible to tell the difference when testing for Bluetongue if an animal has been vaccinated or naturally acquired Bluetongue? When you're testing for antibody, no, the vaccine and the antibody coming from the actual infection, it'll be effectively the same result. So I think I'm clear on that, Conor. There's no difference. So we can't tell the difference between that, and that's important in terms of surveillance as well. And why at the moment you must register with your vet. The vaccine is used in a group of animals, and you must retain the identification of the animals that have been vaccinated for 5 years. That's the current rules around the vaccine. Refer that to your practicing vet. Maintain the records. So any of you there are using something like, look, our own product, PharmOps, any of these things, keeping your drug register, make sure you attach that vaccine to an animal number, and we have that facility. Okay, is it possible? Just there's a couple of things there on stock bull storing. Question asked if you what about buying stock bulls? Can they be tested for it? Should you vaccinate? Should you make sure they're vaccinated before they come in? Maybe a little bit of commentary on the stock bulls.
Yeah, I think the important thing with the stock bulls is across Europe, one thing we really have learned is that the stock bull is really, really prone to Bluetongue. They become viremic, run temperatures, and they become infertile for 2 to 3 months, which essentially the season is over at that stage. So I definitely recommend every stock bull to be vaccinated before May, so I mean before the peak season. if your stock bull is out with cows at the moment, vaccinate him at the moment. It's a dead vaccine. It's perfectly safe. It's used across all the studs in Europe with no impact on semen fertility. If you're selling stock bulls, do you know what I mean? And if you cannot get the vaccine or haven't got it yet, just tell the buyer, do you know what I mean, that they need to vaccinate.
Okay.
And really watch the stock bull. And if you get Bluetongue in the herd, I would be semen testing that stock bull. You know what I mean? Because if he goes infertile, you just end up with too many empty females, and at the price of stock now and the price of both beef and dairy and calf heifers. So I mean, it's a huge cost.
So, and also, if in doubt, Doreen, am I right in saying like you don't know whether a bull might have been vaccinated or not? Maybe someone doesn't know, you're buying a bull or a bull is coming into you. Is it reasonable to PCR test that bull for the actual virus? Remember, there's a test for antibody and there's a test for the virus. Has that any use to us in terms of buying stock bulls, do you think?
I think the big thing, most important thing is the amount of viremic animals in the country at the moment is tiny, and they're more than likely calves or aborted, do you know what I mean, fetuses. So my first aim would be to vaccinate that bull, give him 2 doses, 3 weeks apart, and then 3 weeks after that, then he'll have immune developed, and all stock bulls should be semen tested anyway before they're let off.
Okay, very good. Connor, there was a couple of questions popped in about production losses. First of all, one of the questions was, have you any experience of seeing production losses because of vaccine? And the other thing is, like in terms of that milk production loss, and I know Doreen highlighted some of that in terms of the UK work. What do you think from an Irish context? Is that on your radar?
It is. So certainly the milk yield losses have been significant. Particularly the kind of the Netherlands reports is fairly well characterized there. I think that the difficulty with a lot of these things is that we're dealing with averages. So on average, those losses can be, 1-2 kilos per cow per day, but they do seem to be in some of those cases sustained for a decent period of time. And maybe less of, potentially less impacts in the UK, although they don't necessarily have the same data sets to be able to study that. I suppose the point I would make is that yes, there's definitely a well-established impact of the disease on milk yield, but as Doreen said, the big thing that I think will kind of maybe scare most farmers is that kind of fertility impact. And then in terms of the vaccine, detrimental impacts of the vaccine, none reported, I guess, is kind of what I've come across either in the literature or speaking anecdotally, to vets and farmers across Europe.
Okay. Just one or two things on the vaccine side again. Again, there's lots of questions about how to use the vaccine and so on. One question here is, Conor, maybe for you again, vaccine efficacy if BTV 8 or 12 arrives in Ireland?
Not effective. Yeah, so they're individual serotypes and the vaccines are serotype specific. So that would be a different conversation if that was if those did end up arriving in the country.
Yeah, so let's keep surveillance. Let's see what happens there. But at the moment, we're BTV3. That's our bugbear, and we need to deal with him. Okay.
Because I think the big thing, Martin, here is we deal what we have. We deal what's in front of us.
Sure.
And what's in front of us now is BTV3, right? We have the vaccine for it. Just let's go ahead and do it. We have a window there now of 3 weeks where we'll really have the immunity established before the mid-season.
Okay, another one for you, Doreen. If you're going to vaccinate all the AI bulls and they're all going to be done and dusted, why would there be a problem with fresh semen? You might just explain that. Just the question has just popped in.
We've all the bulls vaccinated, and we're PCR testing them every 28 days. Also, all our semen is frozen semen is quarantined for 30 days. And earlier on in 2026, we sat down with you, Martin, the two of us really, and we made the decision that being responsible, we should not go with fresh semen, just in case, in the very odd chance that we have a vaccination breakdown and a bull ends up positive, and that by the time the semen is tested, some of it has actually gone out to farm. So it's just belt and braces job really that we can stand up and say we are confident that there is no BTV Bluetongue virus in any semen straw we put out there.
Yeah, look, and I think another question has been asked, and I think this is part of what people have to realize also. You can vaccinate an animal that's perfectly healthy, doesn't have BTV, but that animal can get BTV and have virus in its blood or in its semen for maybe a very short period. The vaccine will reduce the impacts in terms of what we call the viremia, or the presence of virus in blood. It'll also reduce the affected clinical signs and the impact on fertility and so on. But you may get an animal that has virus, is still virus positive for a shorter period and will not display any signs or illness. Again, I'm going to lean towards you, Conor. Am I correct in what I say there?
Yeah, no, I think that's fine. Most of the claims will be around protection against clinical signs, and perhaps less effective at kind of stopping animals from getting infected. Sorry.
Sure. Okay, so we're back to a good few questions there about, well, cows and calf at the moment, and should we vaccinate? Again, follow what Doreen is saying there. We're okay, animals being pregnant, even on the safety or the leaflet within it's okay during pregnancy. So again, it's protection before the midges. That's the key piece. So I mean, I think remember that. So it's okay, pregnant, non-pregnant, whatever status the animal is in. Question maybe again for you, Doreen. If I have a really nice calf that potentially could go to AI, should I vaccinate them?
Oh, I think once you vaccinate the entire herd. We've no issue whatsoever with vaccinated bulls buying them, because all our bulls are, going to be vaccinated. And with a lot of herds vaccinating this year, a lot of the young calves we're going to be picked up are going to have the antibodies. We'll just blood test them to make sure they haven't got the virus. So no issue whatsoever with the young animals being vaccinated. I'd see it as
Okay,
an advantage.
very good, Doreen. There's some savage typing going on. I better answer this question because it's been asked, I'd say about 12 times, right? And I've been deliberately backing up the truck here on this one. And can we use it with other vaccines, right? The usual, everyone is facing into a vaccine period here. I'm going to give a stab at an answer, and I get some support from Doreen and Conor. We have discussed it, and look, even within our Herd Health, and Elaine and Dennis and so on will come across this a lot. How we use vaccines. Vaccines made by different companies, and they're made of different things. And again, if you look at any vaccine protocol, you may have what we call inactivated vaccines, modified live vaccines, and they all do different things to the animal's immune system. And companies will stick by their data sheets. Boehringer have said to me, look, they've no contraindication on it. But obviously, if you're looking at vaccines that are, say, live vaccines like IBR and so on, need to be a little careful about how we're stimulating or overstimulating that animal's immune system and whether that animal is immune competent at the time. So you may give them multiple vaccines, and you mightn't necessarily get all the responses you want from all those vaccines. So remember, in any population of people or animals that we vaccinate, you vaccinate 100 animals. Some of them will be super vaccinated, and some of them actually won't respond very well to the vaccine at all, but the majority will be fine. And the more that we vaccinate, we do. So if you're going to use multiple vaccines, chat with your vet about the types of vaccines you're using. I think that's very important, that you're not mixing types and challenging the animal maybe in different ways. Have a look at some of the data sheets and make sure they're not actually contraindicated. I'm not familiar with all the different brands and the different names. It's not just enough to say, can I do lepto and BVD together? There's different brands and there's different vaccines. And I think take your vet's advice on that. It's an inactivated vaccine. It is likely we can use it successfully with other inactivated vaccines. But have a chat with your vet on the types of vaccines you're using. Anything you want to add, lads, on that answer, or shoot me down or whatever?
I think the important thing, Martin, is we vaccinate. That's the first thing.
Yeah.
The secondly, try and get into 2 shots before the peak mid-season in May. And ideally, try and have the 2 shots gone in, in mid-April, mid-early April, so that we have immunity, from May on. Try and pick a dry date of vaccine, get a bit of help, and be as clean as you can. Once you get the vaccine, keep it in the fridge. You cannot reseal the bottle. It's quite clear in that. And the Boehringer brought in the 50-dose bottles because that's how they could churn out more vaccines. So don't reseal the bottle, use it. And I think for beef herds and smaller herds, I mean, 2 or 3 people can join up together. Ideally, only vaccinate healthy animals.
Yeah, I think that's the key one. I think the fact we're vaccinating healthy animals, and I think we can take a lot in that, or healthy animals can take a lot in that situation. If you have anything to add to that, Connor, are you okay with what
No,
we're
I was
saying?
just going to add that, add that last point. I think you kind of raised it, Martin, when we discussed it before, but, making sure there's not sort of other co-infections with other things going on at the same time. Yeah.
Okay. So
And
look,
sorry, there's one
sorry,
other
Dory.
thing. Yeah, Bluetongue, it's so serious. You know what I mean? And looking across Europe and what has happened there, and as Connor says, mild to catastrophic, I'd be very slow in using another vaccine with it. Because
Yeah.
even if you vaccinate today, the 12th of March, it's another 3 weeks before you do your booster, the 2nd of April. There are 2 weeks in between which when you can use another vaccine. Do you know what I mean? So
Yeah.
if it's a case of just getting in farm relief to mix the milk the cows and you do the vaccine, do you know what I mean? I
Mm,
think that's key.
mm. Yeah, look, and absolutely correct veterinary direction is vaccines really should be separated out to give the animal a chance.
Yeah.
So we'll leave it at that. Have a chat with your other vet. Look, I think that there's a couple of other things. One other practical thing about vaccine actually is interesting questions. Where to give it, where to give it, and how to give it. I always find it, we always have an assumption that everyone knows how to give vaccines. And again, it's an intramuscular for cattle, okay? It's a 1 ml shot. It can be given into a good muscle in the neck and given into the hip. It can be given into the area of the freeze brand, but you've got to be super clean. Because also remember, please, with Bluetongue, if you have an infected animal with Bluetongue, or it's a possibility you're using vaccines, it's passed by blood and needles. Remember, it is passed by blood and needles. You must be clean. So if you are a positive herd, that's one thing you really got to think about in that as well. So needles that are long enough that don't deposit it just under the skin. If you use something that's too short on an automatic syringe, be careful. You're actually getting into a muscle. Light skinned dairy cows pretty good, but big sucklers might be different. So just be a little careful with that. And I think, as I say, be clean, change needles regularly, etc. So look, I mean, I'll again have that conversation with your vet. They're best positioned to advise you because they understand your crush, your animals, your system, and what you're used to being able to do yourself. Couple of other things. The one really good question now, the super question here. Okay, I vaccinate the cow. She's going to have a calf in the future. Is that calf going to be protected by passive immunity or active immunity? And therefore, does that calf need to be vaccinated? Do you want to hazard at that, Connor? I have a few ideas in my head, but I'm going to throw you under that bus for a minute.
Yeah, well, look, I guess what we would typically expect is that you can pick up those antibodies in the calves, afterwards with any infectious disease. We'd often expect we get some maternally derived antibodies. I haven't seen anything about whether those are sufficient to protect the calf and for how long that protection would last for. So I guess I would probably go on the assumption that you should be vaccinating those anyway. So that's just, but if you've other kind of view than that, Martin or Doreen.
Yeah, no, I'm with you on that, and I wasn't testing out to see if we were the same on it and say we could slap each other, but like if we look at what Doreen is talking about, getting vaccine in now to do the protection and get it right before the mid-season. By the time these cows now are calving down at the other end, you're talking about like the companies are talking about an annual vaccination, but we're still not sure the extent, and individual animals will be different. I think if you're looking at passive immunity to protect calves, you're going to be probably vaccinating before calving, which is losing all the what you need to do in terms of the mid-season in our spring season. It's different if you're an all-year-round guy. So I think definitely we'd be very sketchy on the quality of immunity that calf would have to prevent disease, but there may be antibodies present. So I think that's a valid answer. Okay. I just want to talk about sheep for 1 minute. We don't want to ignore them. We know lots of beef farmers on and people who have sheep, and so some of the dairy boys as well. And again, it's a really useful way. The question has been asked. I got some beef cattle. Why not use the vaccine on sheep if you got them as well? So you use up that 50 ml bottle, and I think it's important. And again, follow Doreen's very clear. Open the bottle, can't reseal it. You've got to use the bloody thing. So sheep, a different protocol. Again, it's pointed out. It's under the skin injection. With any of the vaccines, but Boltavo being available in Ireland, it's under the skin injection. It's 1 ml and it's one shot only, with immunity developing in sheep approximately 3 weeks later. So single shot to sheep. So if you have a small number of cattle and you have a local sheep farmer down the way and you want to trade vaccine, I'm going to say that really carefully, but if you want to, if you want to use the vaccine on other sheep, please do. There was another piece there on a question was asked. I've vaccinated some ewes post lambing to protect them. Do I need to go and vaccinate what stage about the lambs? Probably 3-4 weeks old lamb, month old, will follow maybe the same rules around sort of non-infected animals that don't have maternal antibody. And I think it's reasonable to consider vaccinating the lambs maybe month old. That's what we probably look at there in terms of the sheep piece. So hopefully we've helped you a little bit with the bottle size. The company isn't going to change, and we're not going to magically instruct a company to make it in different bottle sizes. They were trying to get the quantity into the country. So hopefully we can manage and work with it. Let's just see. I think we've covered quite a bit.
The one thing there, Martin, is I saw
Keep
one
going, Doreen, yeah.
question flashing up there. There is no withdrawal period on the vaccine.
Spot on. Yeah, that's one.
Yeah.
I keep running down through them here because there's lots and lots and lots of questions there. The Bluetongue vaccine being given at the same time. So just bear with me for a minute to make sure. Yeah, we've answered the withdrawal question. That's fine. And again, the data sheets are very clear. Just pop open the data sheet. It'll tell you. Question there: is there any issue getting the vaccine? We don't see it. It's just this delay in registering that you're using it seems to be the biggest issue. Is that your experience, Doreen?
Yeah, I was speaking to a couple of vets. They thought they'd have it last week, and they're promised now they'll have it next week. But Boehringer are quite confident that anyone who wants the vaccine will have it. Before the end of March.
Okay. Do all the vaccine manufacturers cover the same strain? Yes. At the moment, the 3 vaccines that are licensed here are all BTV3. We've one in country, and I think Verbac are hoping to get in the next 2 to 3 weeks and bring in their vaccine in. I'm not too sure about the third maker, but they're all the same strain at the moment. Just want to make sure now we just haven't missed anything when we've taken the opportunity. We've covered a lot of them. There's a few questions about export to the UK around vaccines. Again, they're classified as third country, so I think there could be some issues around the health cert. Do you haven't any update on that, Doreen? I want to be clear. People are asking if I'm selling animals to the UK, and is there an issue around vaccine with them? I'm not sure of the answer myself now, so I'm throwing it out there to the two of you.
Basically, there should be no issue because the UK are vaccinating, right? And basically, we can differentiate between vaccinating animals and animals that are actually positive for the virus. The important thing is protect your own herd, because you could lose your herd just trying to protect one animal to go to the UK, while you're a lot better off. So, there will be no issue because all across Europe, they're all vaccinated.
Okay, so have a chat with your RVO just if there's any specific third country health cert issues, because UK is a little bit different, okay, because the EU is going to come under the standard scheduling that we have. And just to differentiate, I know what Doreen was saying there, we cannot differentiate with the antibody test between disease and vaccine, but we can differentiate between an animal that's got an antibody in it and the virus itself. So they can be virus tested, okay, so that is a differentiation that can be made. So look, have a chat with your RVO. I'd be reluctant to take a department position on exporting to the UK here. Okay, guys, I think we've covered a lot. Another interesting one has just popped in there. My understanding, Doreen, there's no semen or germinal products coming from the UK into Ireland. Is that correct?
Oh, there are. There are.
Coming in with health cert.
Yeah, they're coming in with a health cert. And it's important that you only purchase semen, through a reputable supplier. That you aren't dealing with semen that's coming in trucks and so forth.
That's really important.
And all animals in AI centres, are subject to department and EU regulations. And there are regulations there for third country trade, which the UK are bringing semen into Ireland at the moment from.
Okay. And a last one there, just a question on organic farms getting a derogation to vaccinate and so on. Look, I think you really have to have a chat with the certifying body and just see where they are. And I think your vet, there will be a certain amount of interaction between the vet and the certifying body, if I understand correctly. Conor, you might know a little bit more about that, or maybe I'm wrong in what I said.
I think you'll have to go to the certifying body, I think, for that one.
But the important thing is to lobby the certifying body. You know what I mean? To
Yeah.
make sure they allow vaccination, because the welfare, financial, and human impact of not vaccinating and Bluetongue coming in, do you know what I mean? It's far more important. Do you know what I mean?
Okay. And one I've almost missed, but it was in the back of my mind the whole time. Um, and interesting, someone has just commented here from organic side, don't need derogation for vaccines in organics. Vaccines are fine, classified as animal welfare. Absolutely. Just look, just make sure to check. One last thing. Advice, a lot of chatter about using insecticides, Stockholm tar, other things to keep midges off, various remedies and so on. Just maybe give an opinion. Conor, looking at research, have you looked at some of this area, or what's the we haven't mentioned it at all, so it's been asked on the chat.
Yeah, I think to very, very quickly, like I think the only evidence we have in terms of effectiveness for stopping transmission is vaccination. There is some confusion perhaps around the kind of the chemical kind of treatments for the insecticides, and I guess the confusion there is that they seem to be pretty good at killing midges, but the point is that what seems to happen is the midges land, they feed, they pass on the infection, and then it kills them afterwards. So that's my understanding of what happens. But I guess even that aside, the main point is they don't seem to be sufficient to stop the animals getting infected.
Okay.
I think the
Yeah.
point, I
Sorry. Go
think
ahead, Doreen. Go
I
for it,
think the
chat.
important there, Martin, is we cannot depend on insecticides. There is no evidence there. Do you know what I mean? That they are effective. Vaccination is the most effective. However, one place when I was talking to a few of the vets in UK where they use them is if you were transporting an animal from point A to point B to make sure you weren't taking infected midges with you. You know what I mean?
Okay.
You treat that animal with insecticide.
Okay, very good. I'm just thinking of applying when I'm on holidays, mosquito repellent, and the buggers still bite me. So I'm not convinced someone's going to pour something, give me 10 mil of pour on down my back when I'm in Italy the next time. Anyway, let's see.
Oh, Martin,
Um,
the only landing good meat.
yeah, the good on you, Doreen. I always knew you'd say something positive. Just a point there again. I think someone who has more authority in the organic piece has just popped in there. Organic just needs to be on your animal health plan. So well and good, lads. There is some other questions there. I'm just going very look summary for me. I think we've kind of decided to come on this webinar and be quite definitive. I think they're and I suppose operating in the breeding and the fertility space, and also we are so cognizant of the impact of disrupted 6-week calving rate within what we see in terms of the Irish system, and it's kind of our bread and butter a little bit. And I suppose in a breeding organization, we're in it all the time. We often don't realize, or you get so familiar with it, you kind of say, well, it'll go on as it is. But I think we kind of took a position that we needed to be a little bit strong on this, and we can look at the risk and say, okay, that plume mightn't arise, or the overwintering mightn't happen. We might get a burnout in an area. But I think, and in risk management overall, when we have something that can prevent the potential catastrophe that we're talking about, I think with the value of stock today, the value of our business enterprises, we'd be very reluctant to fudge it. So look, I'd certainly like to thank Doreen for being clear. I think that's been very helpful. And I think, Conor, the information that you've given around the background of it gives a lot of confidence, I think, to people that the institutions and our educational institutions and the Centre of Epidemiology that you're working with are doing highly valuable work, which is assisted greatly by farmers, weighing into that surveillance piece, getting those samples in and so on. It's extraordinarily helpful. Okay. So look, on that note, I also want to thank, I generally have something written down here. I was only complaining to Doreen before I started that my bloody writing is so bad I forget to thank people sometimes. But I want to thank Maeve Keane. Maeve in our marketing department in Munster has done fantastic work all year. Webinars has been a part of her thing. And we've had a lot of very successful webinars. And I know we've gone on a little bit. We've hit the 9:15 bell or gong. So I'm delighted that so many rocked up on the webinar. And also, would you please continue to have a safe season? We'll sign off on that basis. I'll just look at the last two messages. Okay. There's someone asking maybe to share the webinar. We might have something on regarding export. Okay, there's some commentary there. I think again back into your RVOs. So lads, I'm going to leave it at that. Thank you so much.
Sorry, Martin.
Sorry, Doreen. Go ahead.
I think one point we didn't cover is come the 15th of July, Bluetongue is going to be declassified.
Mm-hmm.
And I don't know, Conor, whether you want to comment on that or not, but the big thing is it's not going to affect the impact if the disease comes in, but it will affect, do you know what I mean, how EU and third country, do you know what I mean, are going to view exports and imports.
Okay. Absolutely. Yeah, absolutely. And we will deal with that. And again, we'll see the situation. We'll deal with it inside in the bull studs. Webinar will be available on YouTube and so on. And I think we'll post it around again on our social media. Lads, thanks again. Head off. Appreciate it.